we actually have some more risk factors that may put you at risk for stomach cancer. So let's walk through them and let's see if we can take the first one, which is the H. Pylori infection.
Right. So this is huge because the development or the learning about the role of H. pylori in gastritis and gastric cancer has changed the way we treat peptic ulcer disease. It was discovered in the 1980s that patients with gastric cancer and patients with ulcers also had a high incidence of infections related to H. pylori, and we found that by treating that infection, we can prevent the gastritis, prevent the ulcer disease, and also prevent the risk of gastric cancer.
And how do you know if you suffer from this H. pylori infection?
So if someone has symptoms at the time of endoscopy, the gastroenterologist can actually biopsy the stomach and culture it.
Got it.
There's also stool tests and blood tests that'll show whether or not you're a carrier if you have an infection.
Excellent. All right, stomach inflammation is one. Male gender, you had mentioned more prevalent in males. Diet includes many salted, smoked, and pickled foods. Really?
Yeah. Yeah. So gastric cancer has actually decreased over time as we've changed the way that we save our meats. Now, with refrigeration rather than salting process, the risk of gastric cancer, the incidence has gone down. Countries where there's a prevalence of smoked meat consumption have a higher incidence of gastric cancer. So definitely there's a strong link between what we eat and the risk for gastric cancer. And the American Cancer Society usually recommends you have at least 2.5 cups of vegetables and fruit a day, which they believe helps mitigate some of the inflammatory process that can lead to gastric cancer and other GI tumors.
Fantastic. All right. Of course, smoker, that's always on the list.
It's always on the list.
And family history of stomach cancer.
Right.
That obviously genetics, where you come from.
Right, exactly. I mean, if your mother had gastric cancer, if your father had gastric cancer, if they had gastric cancer at an early age, right, then these are all indicators that you may be at higher risk and you may need screening.